me get a little closer than that, Janet. Okay, good afternoon, everybody. Happy Friday. We made it through another week together during coronavirus. We've covered a lot this week. We have been here every day this week at 1 o'clock to talk about schools. It's Labor Day. It's time to get the kids back to school. And this year is different. It's more confusing, more difficult, more anxiety producing. And so we've tried each day this week to give folks a little bit of information so that you can be more prepared, you feel more confident, and really just remember as we go back to school, information is power. We're about facts, not frenzy, and schools will open because they are safe, because we are taking the necessary precautions to limit the risk so our children and our teachers can do what they do best, which is teach and learn in school and do it safely. So I want to say thank you to everybody who has worked so hard on my team to make this possible. All weekend long, we'll continue to work. Had a long call this morning going through where we are on different precautions, and we're at it. We're at it because we know our children deserve a great education, and although this year will be different, I am optimistic and confident that we're going to make the best of it and have a good school year for our kids. Next week, we'll be back to our regular press conference on Wednesday. So this week I've been here every day. Next week, just once, Wednesday, 1 o'clock. I'd encourage you to tune in next Wednesday at 1 o'clock. So we'll begin today with the data, as we always do. And thankfully, it's another good news story. Yesterday, we performed over 8,800 tests. That's amazing. Seems like just, it seems like yesterday we were trying to figure out how we were going to be able to do 1,000 tests a day. Yesterday we did almost 9,000 tests, average turnaround time less than 2 days. And here's the good news. The percent positive rate is 0.7%, less than 1%. That is very stable picture. As you think about going back to school, you should know, look at the facts, we are in a very good place. I had Dr. Fauci on with me a few weeks ago, and he said, because Rhode Island is in green, the test positive rate that is so low, you ought to be able to get back to school in person. We saw 58 cases and thankfully no new deaths. So yesterday was really a good news story in our fight against coronavirus. Today, I'm going to limit my comments to school sports. I would like to just take a few minutes to talk about school sports. Youth sports are vital. It's not just about sports. Any of us who played sports, and I think the 4 of us up here did, know how important it is in the life of a child. It's about having a chance to have a mentor who's an adult, who's a coach, seeing your friends, learning how to get up when you fall down, learning discipline, how to be a competitor, get some fresh air, be healthy. For a lot of kids, it's the reason they stay in school and try hard at school because they want to be able to play sports. So it has a huge impact, and I know that. I've lived that. I see that in my own children. And so because of that, we've all worked very hard to make it so that kids will be able to play school sports. Over the past months, but particularly the past few weeks, we've worked especially closely with the Rhode Island Interscholastic League to figure out how we could make that happen. And I want to give a huge thank you to Mike and Tom at the Interscholastic League, the executive director and assistant director, for all of your hard work. You guys are amazing. You have a can-do attitude. Every time we give you a challenge, what about this? How are you going to handle that? What about transportation or masks? These folks get to work. They have a can-do attitude. They solve the problems, no excuses. And I have to say, on behalf of Rhode Island's children, thank you for doing all that you're doing. I'm also trusting you to enforce the guidelines and make sure that these guidelines are followed so our kids and our coaches are safe. I also have to thank Director Janet Coit on my team. She's yet another mom who's leading Rhode Island's COVID response, and she's done just a beautiful job not only with parks and beaches, leaving the beaches open for the next few weeks, but with sports. She's been on it at every step, working with the Interscholastic League collaboratively and creatively, so thank you for your hard work. And of course to the commissioner and Dr. Alexander Scott and the members of their staff. This has been a real hands-on deck effort. So the big announcement for today is I am very excited to announce that there will be school sports in the state of Rhode Island this fall. Like everything else in our lives, it's going to be different and not the way we might want it or the way it was last year, but we will get to play. I'd ask you to please put the slide up. So as we know, as we've learned, outdoor activities are much safer than indoor activities, so we are only allowing outdoor sports for this fall. Only outdoor school sports this fall. School fall sports will play an abbreviated season. Practices will begin as early as September 21st. Competitions will begin a couple of weeks later, and the season will wrap up by Thanksgiving. Now, we have worked, as I said, with the Interscholastic League, which is the league that oversees high school competitive sports. I do want to be clear, however, we hope and expect middle school kids will also have a chance to participate in school sports, and we are issuing the same guidelines for high school and middle school. So what I'm about to preview now are guidelines for safe school sports, which apply to all kids, middle school, high school, etc. As you can see on the slide, we've divided fall sports into 3 categories based on their level of risk and degree of close contact. And the Department of Health was involved in creating these guidelines, and we follow the CDC guidelines. In the green are cross country and tennis. No contact sports, outdoors, very low risk. So those 2 sports, cross country and tennis, will be able to be played competitively this fall with really very minimal changes. The next level is in yellow, indicating a bit riskier, includes soccer, field hockey, and sideline cheer. Now, these sports have more physical contact than cross country or tennis, but we feel it's safe for middle school and high school kids to participate in these sports. They're played outdoors on relatively large fields, and there is an ability to limit the degree of close contact between players. They will, however, be played with certain modifications. It's not going to be soccer exactly the way it was last year. By the way, these modifications will be consistent with what other states across New England are doing. The experts of the Department of Health will be working with the Interscholastic League and DEM to identify exactly what those modifications will look like. And once they are determined in the next couple of weeks, they'll be communicated to school principals, athletic directors, and teams before the start of the season. Now, you're probably going to want to know today, Governor, what exactly are the restrictions? We don't know yet. They're going to take the next couple of weeks to refine them, but you will know before September 21st. It'll be things like new regulations around disinfecting the ball, penalties for intentional direct contact, electronic whistles for referees, restrictions on throw-ins. So that's the kinds of restrictions they're going to consider. We believe that those modifications will allow you to play the game in its essence, competitively, but also keep you safe. Finally, consistent with the proposal put out by the Interscholastic League, football and volleyball will not be allowed this fall. And I know that's a bummer, and I'm sorry for that. Volleyball is played indoors, and all the players touch the same ball. So we don't feel it is safe for us to right now have competitive high school volleyball. And football obviously requires very close contact through blocking and tackling. So that, I understand, is a great disappointment to a lot of kids out there. But I don't want you to lose hope. What we are hoping, expecting, and planning for is a season in the spring, which we're going to call Fall 2, which will be the Fall 2 season in the spring, where we hope you'll be able to play football and volleyball in the spring, hoping by then things will be better and it'll be safer. And the Interscholastic League has thought very creatively about how to make that happen within a 4-season format. So again, they've really had a can-do attitude to break down barriers. I am hopeful there will be football in the spring, and in the meantime, stay in shape, maybe run cross country, and hang in there. We hope that you'll be able to play in the spring. So these are the state's guidelines for fall school sports. They're consistent with the framework developed by the Interscholastic League. Our goal is to give the broad framework for how kids can play sports safely. And then, this is very important, we're telling you what we think is required to keep our kids safe. We are trusting principals, coaches, athletic directors, parents to reinforce these safety guidelines. Parents, coaches, players, athletes, folks at the Interscholastic League, principals, athletic directors, help us out, enforce these guidelines, enforce the modifications. Don't try to look for ways to find shortcuts. The right thing to do is to let these kids play sports, to follow the rules so that they can continue to play sports safely. If it turns out that halfway through the season it's not working, we're seeing outbreaks, we will reconsider the guidelines and have to pull back on school sports, and nobody wants that to happen, and I don't think that should happen. So let's do the right thing. Let's keep each other honest, help each other to follow the rules, and really be strict about the rule following so everyone can be safe and we can continue to play sports. The guidelines entitle students at all schools to play in these sports, including those in districts that are doing full distance learning. So I want to be clear about that because this will be a question. Providence and Central Falls can play sports. Even in districts where the school committee or superintendent have decided they don't want the children to go back to school, we are allowing the kids in those districts to go ahead and play sports according to these guidelines. We decided it wouldn't be right to punish the kids for the unwillingness of the adults in their district to do the hard work of getting the kids back to school. And particularly in those districts, when these kids are going to be alone and isolated in their room for 6, 7, 8 hours a day, this might be the only opportunity that they will have to have in-person contact with a mentor, in a coach, or with their friends to get out of their house, to get some fresh air, and to be part of a team. So again, huge thank you to all the coaches and everybody who made this possible, and I hope all the kids have fun. Finally today, I want to say a quick word about Labor Day. Good news and bad news. Good news, weather's supposed to be great. It's supposed to be a beautiful, sunny, terrific Labor Day. Bad news is I hope that doesn't encourage folks to have large social gatherings. I want you to have a good time this weekend. It's the official or unofficial end of summer, but I want to remind you, social gatherings are limited to 15. 15. If you're having a family gathering, a pool party, meeting up at the beach, having a barbecue, having a Labor Day cookout, 15. And I know a lot, this is hard for a lot of people. I get it. I come from a big family. A lot of people say, oh, but Gov, we have our family cookout every Monday on Labor Day. I come from a big labor family. The whole family's going to be there. It's 30 people. You can't do it. If you do it and we find out about it, we'll fine you. It's not allowed. It can't happen. Over the 4th of July weekend, too many folks were out and about in close gatherings, congregating at beaches, at parks, in backyards, etc. And we saw it in the data. More people died than had to. More people went to the hospital than had to. I've had to close bars at 11 o'clock, and we had to push our social gatherings back to 15 people. So I am asking you, please, enjoy your Labor Day. Take a minute to celebrate labor, but please stay outside. If you're near people, for more, wear your mask. Stay inside if you are sick. Get tested if you are sick. No big gatherings. I want to talk specifically to the college kids. We are out in force this weekend at all of the bars and hangouts where college kids typically are. And we expect that college students will not be partying in fraternities, will not be partying in houses in groups greater than 15, will not be crowding into bars, and no college bars will be open past 11 o'clock. And if you are, there will be penalties. And to the colleges, we expect you to enforce these penalties on your students. By the way, I want to say thank you to all the college presidents. They're doing an unbelievable job in difficult circumstances. And I want to thank you for all that you've done. So have a great Labor Day weekend. Let's not have a repeat of 4th of July. And let's just do the right thing. Follow the rules, have a good time, and let's keep us in the stable position that we're in, where we have a lid on COVID and we're allowed to live our lives, and folks get to go back to work and the kids get to go back to school. So thank you. And with that, I'll turn it over to Dr. Alexander Scott.
Thank you, Governor. Good afternoon, everyone. I want to reiterate what the governor said in terms of sports, along with the educational activity that we know is important with school. Sports also is a key part of the physical, social, and emotional development for children. So we want every district advancing on both the school and educational attainment, as well as the sports values and benefits that we know are true for our students. Thank you to everyone who has been working so hard for the last few weeks to pull together such a thoughtful, public health-driven plan for fall sports. Our teams and Director Coit with her excellent leadership and thoughtfulness and input. In terms of numbers for today, we have 58 new cases of COVID-19 to report. There are currently 76 people with COVID-19 hospitalized in Rhode Island. 8 people are in an intensive care unit, and 4 people are on a ventilator in an ICU. Thankfully, as mentioned, we have no new fatalities to report today. Okay, because mask wearing is going to be so central to the COVID-19 prevention plans in schools, I want to take a few minutes to talk about masks and how critical they are and will continue to be in getting us through a successful school year. The best face mask is one that fits snugly but comfortably over your nose, mouth, and chin without any gaps. When there are no gaps, respiratory droplets cannot escape. Those types of droplets that come when you're speaking, laughing, singing, sneezing, or coughing are prevented by a mask from extending out and exposing someone else. That's why a face shield alone is not a replacement for a face mask. And that's also why a loose-fitting bandana is not an adequate replacement. As we're learning more, it's really about making sure that the mask fits snugly. And we can continue to both model for students as well as encourage students to be creative on ways to have masks that can tell a story, that can be colorful, can be fashionable, and also keep everyone safe. When you talk or laugh or cough or even breathe, these respiratory droplets can carry the virus leaving from your mouth. When those droplets get inhaled into the lungs of someone else, that is how COVID-19 can spread. Wearing a mask is critical to preventing the spread of COVID-19 because it can prevent those respiratory droplets from getting dispersed. We have continually learned that mask wearing is one of the primary mechanisms that we have in place to control COVID-19. Wearing a mask works. We know that unequivocally. A research paper published this summer in the Journal of the National Academy of Sciences estimated that in 1 month period, mask wearing alone reduced the number of infections by over 78,000 infections in Italy and by over 66,000 in New York City. Those are incredible numbers to get in just 1 month with just mask wearing alone. We've talked about layers to decrease your risk, particularly in our discussions with schools. We want to be clear that wearing a mask is one of the most significant layers you can use to decrease the risk of transmission. As a reminder, mask wearing is essential when you are indoors and outdoors. You are not in the clear just because you are outside. If you will be around people not from your household, particularly this Labor Day weekend, you need to wear your mask, whether you are inside or outside. As the governor said earlier this week and reiterated again today, we did see a bump in cases and hospitalizations in mid-July following people getting out and about in social gatherings on the 4th of July that impacted those numbers, particularly people not wearing masks effectively. We can change that this Labor Day. We all want to be focused on getting school going successfully. We want businesses to stay open. We want to continue moving forward strong the way we are with our numbers and for lives to be saved. A way to do that is for everyone to wear your mask. It's our shared responsibility together. We cannot repeat what happened July 4th weekend. We have the tools in our hands now to make it so that after Labor Day, our numbers continue to decline instead of seeing what we happened after July 4th. If people don't act responsibly this weekend, it will affect students, families, schools, businesses who need people going to work, and it will affect the entire state. So I'll finish with remember the 3 W's. Wear your mask, watch your distance, and wash your hands. With that, we will get started with questions.
Governor, do you expect players, I guess especially in the moderate risk category like soccer and field hockey and cheer, to wear masks?
Why don't you come talk about that?
Good afternoon. Yes, that will be part of the modifications that we're discussing with the Rhode Island Interscholastic League, and my expectation is they would be wearing masks unless they were distanced. Some of the sports, if you're the goalie and all the actions at the other end, you could let your mask down, but that's my expectation for those sports that have more close contact.
If I could ask you, Governor, just 2 questions, maybe both of you. First of all, on a lighter note, Governor, the most important sport of all, as you know, is rugby. Absolutely. Absolutely. As a fellow rugby, is there any potential for a rugby season in the spring?
I think probably not. I often joke that my brief career as a rugby player was by far the best training for politics that anyone could ever have. It's true. No, I mean, I don't see rugby happening this fall. Okay. It's even more close contact than football. Maybe spring too, or fall too.
On a serious note, at the professional sports level, where there have been successful seasons at some level, hockey and basketball come to mind. They've operated in the bubble. And of course, the bubble means separate living facilities, separate everything. They live in an alternate reality. Even in a limited contact sports environment, it's, as any athlete will tell you, it's not just the game itself, it's the after game showers, the close transportation in buses, all the other parts of being a team. You're in close quarters all the time. How do you control that in
Yeah.
high school sports?
Yeah.
And
So
keep
I
it
want to
non-
address that, and then I do want to ask Director Coit because she's really in the thick of it. So first of all, that's why I really leaned in heavily in this press conference to the coaches, the players, the athletic directors. We're gonna have to be vigilant around this in terms of, like for instance, transportation. They're working on ways so that it can be done with limited need for busing. There's going to be new protocols for showering and changing, mask wearing, and you're right, it's a risk. The Interscholastic League has done a really good job of thinking through how you mitigate the risks, but the real answer is like enforcement on it by teachers and principals and coaches, to make sure that the kids are following the rules. If they don't, we'll know quickly. We'll see outbreaks, and then we'll have to shut sports down.
Well, and is there the other part of being in that bubble is the level of testing. In fact, it was controversial early on because before there was access to tests, athletes were getting preferential treatment. So is that kind of constant testing going to be available to these high school teams?
It'll be no. It's a good question. We do not have a separate testing effort for kids who play sports. Having said that, we have a really robust testing infrastructure for all K through 12, and we're going to be rolling out a surveillance testing for kids in schools. So there'll be like a random cycle that kids will be tested, and including the athletes. No, this isn't the NFL. We don't have that kind of money. So, but we do want the kids to play, and so we're going to do our best. Do you want to add something?
Again, I want to commend the Rhode Island Interscholastic League, and they have a draft document now, but it's not just what happens on the field, it's transportation. They're thinking of things like having games only on weekends, 1 game a week. It's what happens on the sidelines, how far apart you sit, wearing a mask when you're not on the field. It's what happens in the locker room. So it's not just there is no bubble, but the guidelines and the practices that we're putting together with them will take you from, what happens before, no fist bumping, no, to after the game. They're also, I just want to again emphasize the adherence. They're working with the principals, with the athletic directors, with the coaches to make sure those are enforced. So it's a structured environment in which we have confidence that the rules can be enforced.
Final question. Part of the issue with high school and particularly college sports has been not the athletes who are the fear of God of losing their opportunity to play, but it's been folks attending the events who routinely, grossly violated social distancing. Will that be monitored as well?
It will be monitored. The current guidelines for sports have spectators included in them. The rules are no more than 2 people per athlete, and that any household should remain masked and 6 feet apart. The rules for school sports will put that obligation on the school to make sure that the spectators abide by it, and we will continue with the 250-person outdoor limit for venues of assembly. If it doesn't go well, that would affect, I know there's schools where they've stopped the game or changed the rules for spectators, but we have reason to believe that with those rules, we could control that, and the schools have told me that.
Question for the governor. Governor, so there are some districts that are not even trying in-person learning. I'm not sure how many, but I know of like Warwick and Coventry. Mm-hmm. Was there some thought to that unless you go back in person, that the athletes can't compete?
Yes, we had extensive discussion around that. And we decided that we didn't want to further punish the kids because the adults weren't willing to do the hard work necessary to get the kids back in school. We think it's safe to play sports, and especially if you're a kid who is going to be stuck in your room all day on a computer, all the more reason that you should get outside, play, be with your coach. A lot of kids rely on coaches to, for a mentor or someone to be with. I will say General Callahan, who's a key leader on our team, who's the head of the National Guard, spoke up forcefully in favor of this. As a father of 3 and spent 15 years as a lacrosse coach in North Kingstown, he said, Governor, you got to let all these kids play, because especially if they're in their room all day working, you got to give them a chance. So Look, you know my feeling about this. I think,
Have the districts said that they would allow the athletes to participate?
no, just today as I'm making the
Today.
news. So today, this is why I'm encouraging them to. I hope that they let the kids play sports. Of course, I want them to go back to school too. So they'll know today, and we'll know next week what they're going to do.
Is there just some element of, though, incentive? Let's just say, I don't know how many, but Warwick and Coventry, that unless you make an attempt to get these children back in the classroom, then you're not participating in school sports.
We thought about it. We thought about that, but we just thought that would be punishing the kids even further. And I hear you. We talked about it. Maybe that would have been an incentive to do the right thing and get the kids back in school, but it just felt like doubly punishing the kids because the adults weren't doing their jobs.
Just because you saw those Cumberland students, they had a protest. They want to be back in the classroom with their friends. Just one quick question. Where are we as far as the walkthroughs? Will that be, I believe next week, a number of the teachers are going in for professional development. What percent is that done so far?
A little more than half. A little more than half, right? We've done 170. So I was close, 57%.
And when will that be ideally completed?
Next week, by the end of next week.
Okay.
Certainly before the 14th. It has to be before the 14th. So we're doing it all. And it's going very well. I mean, we're getting good feedback from districts saying, thanks for the help. We hadn't thought of that. We've been telling them you have to do a little better of a job at this, a little better of a job at that. So I'm pleased.
Governor, I know this follows up what I asked you yesterday, but you've now said it multiple times today again about some of these adults not making or doing the hard work. And I'm already seeing, pushback that this is minimizing their concerns and what they see as legitimate challenges. And it's not just an outlier here or there. There's schools doing hybrids and across the board of Massachusetts doing the same. Why do you feel it necessary to keep kind of pushing that message that they're not doing the work when I'm sure they would disagree that they're trying?
Because, first of all, they're right that this is very hard. And in no way do we want to minimize the concerns. So I want to be clear about that. I share the concerns. Believe me, I get it. I get the concerns. They are real. We love our teachers. We love our kids. We want them all to be safe. But I also see what's happening in some of these districts where they have more of a can-do attitude about saying we're going to do whatever it takes to get the kids back in schools, and they're making it happen. So I'm disappointed. Listen, Brian, my job is to look out for all the kids in the state. Kids are going to really suffer for not being allowed to go to school. You're going to have anxiety, depression, suicides through the roof. And you know who's going to hurt the most? Poor kids, kids with learning differences, kids who are already behind. So for me, it's a moral obligation. It's an economic obligation. It's an issue of equity. I know maybe in those schools, maybe they can't get every kid back every day, all day, because the facilities are just can't handle it. By the way, I doubt it. But I know they could get some of those kids in school some of the time if they worked a little harder. Because I see it every place else. I see the can-do attitude in other places. So I feel that the kids need an advocate. And I'm speaking up on behalf of the children and the majority of the families who want their children in school.
And Governor, I just want to make sure I understand. But it's up to the district, say like
Right.
Coventry, so they have to decide if their athletes will participate this fall. Now, many of the coaches are teachers. So you could have a situation where they're saying it's not safe to go to school, but then they're going to coach them after school.
Correct.
Correct. I have a question for the doctor when we get to it. Anita, go ahead.
We'll do
Governor,
everybody.
to the walkthroughs, on Wednesday, you hinted that you would be open to allowing media to go along and tag along, but we were officially denied
Yeah.
by Rhode. So are you allowing media to tag along in these walkthroughs?
So we decided not. And basically because they're really working sessions. And after consultation with the Department of Health and everybody, we said no. We said these are really working sessions. The way they work is they're like a minimum of 90 minutes. The first 30 minutes, they sit down in a room and they just work. They go through the checklist, they go through the plans. and then there's more of a walkthrough. And it's back and forth. So we decided that for that reason, like any working meeting, it wouldn't be open to the press. Having said that, I think it's completely fine for some parents or some teachers or some union reps to be participating in the walkthroughs. In fact, I think that's helpful so they can be part of the problem solving. And so the districts that want to do that and have some of those folks go along, obviously that's their decision, but we're fine with it.
Governor, there's 17 states are playing high school football right now. I think there's another 6 or 7 going this weekend. I'm just curious what the decision was, or what went into the decision to not have football in Rhode Island.
There are some states that are doing football. Some of them are doing it, like Vermont is doing just a flag football, I think 7-on-7, no tackling. We just didn't think it was safe. You know, we're in really good shape. Our percent positive is less than 1%. We want all the kids to go back to school safely. We went around it and around it. I deferred to the experts in both sports and public health. It's tough with these kids. They're literally in football and in rugby, you're on top of each other constantly. It's about as close of a close contact as you can get, and we just didn't think it was safe. But we are hopeful that there will be football in the spring in this fall 2 season. So keep your fingers crossed. There'll be a football season in, February.
With girls volleyball, Connecticut this morning announced they would be playing girls volleyball. Massachusetts is playing girls volleyball. Why not Rhode Island? We're kind of sandwiched between.
Yeah, same kind of thing. We just decided it wasn't safe. It's indoors. All the girls touch the same ball. I don't know if you want to add to this. It's just a judgment call. It's just a pure judgment call based on everything we know. Indoor sports, indoor spectators. It's just less safe. We thought about it. I don't know that there's any right or wrong answer. It's a judgment call, what we think is best for the kids.
Tanya Signori from the Rhode Island Echo to the governor. Speaking on behalf of people who don't have school-age children, and in particular small businesses, whether it's sole proprietors or not, will there be any other funding available for them? State funding, federal, CARES Act money, any miscellaneous money that came through to the state? Will there be anything available, and the approximate time frame of that, when it will be available? And also, small businesses would like to know about the interest that's possibly being accrued on money that's not currently being used, if you could clarify that.
So I think there will be additional funds available. We earmarked the first $50 million, and we've dispersed, I think, about 5 of that. So there's another 45 that we're anxious to get out the door. We are looking to expand the rules to include sole proprietors, exactly what you're talking about. I don't have a timeline on that. I would say within the next month. Supposedly, Congress is planning to come back at the end of September to pass a stimulus bill, and there's a lot of talk about small business relief. That's high on the list, from what I understand. So I think the answer is yes, at least for those 2 buckets, if not more.
For the doctor, I understand problems with certain sports like football, of course. I played center, and my recollection was that the job of the center is to be tackled on every single play because you start with the ball. But does sports as a whole, because it involves teams from different schools competing against each other, violate the cardinal principle that the state has established for the reopening of schools, which is to keep cohorts together and substantially isolated? So if you say, we are going to safely open schools and make sure that each classroom has a stable cohort of no more than 30 people and a teacher or 2 who are the same people throughout the day, throughout the week, throughout the month, throughout the semester, what happens when you are deliberately sending these pods of people to mix with each other, because of course not everybody playing the sport for the same school is in the same classroom, and then have them go to competitions where they're going to play against and interact with a similar group of people from multiple pods from other schools. And to me, it seems that the risk is essentially what a mathematician or a statistician would call factorial. In other words, you're taking on effectively exponential risk here. So how do you monitor that? How do you measure that? And what have you calculated to be acceptable risk and not acceptable risk based upon things like your estimates of prevalence?
It's an excellent question. It's why we talk about layering to minimize risk. The majority of the sports that we are supporting happening competitively are focused on individuals, and so are minimizing groups of teams coming together to interact, and we want to encourage distancing appropriately, hand washing appropriately, and being outdoors. For the team sports that we are discussing and have shared today, we're going to really take what you asked about and what we've been looking at into consideration with the modifications. How do we layer it so that we minimize risk while being able to support, as General Callahan has reminded all of us, the opportunity for students to be able to have the physical activity, the emotional engagement, and the intellectual engagement that we know comes with sports activities. So we want to make sure the outdoors component is in place. We want to make sure things like Director Coit mentioned of cleaning the ball is in place, hand sanitizer, the ability to distance, ability to wear masks where appropriate, keeping stable groups. And we're going to dig in a little bit deeper on what modifications we can do to further minimize risk, particularly among those team sports where we know those stable groups are together. But how do we minimize risk when we have one stable group engaging with a different one?
But that raises the question. I mean, first of all, you pick these numbers, gatherings of 15, classrooms of 30, based upon a statistical estimate of what you want the risk to be. In other words, what's the probability of somebody being in that group having an infection given the prevalence in the community? And that means that you have to pick those numbers and constrain these modifications based upon some sort of risk target and back figure it from that. So that's kind of what I'm asking about. And that raises the other, frankly, toxic question of varying prevalence between communities. What do you do when, I mean, I don't want to single anyone out, but Exeter West Greenwich says we don't want to play Central Falls because their prevalence is 6 times ours.
So I'll start with the first question. A bigger part of the stable group component is actually to help us from a contact tracing standpoint and how we are preparing ourselves to engage were there to be a case and the risk and the calculation of how many people could it have spread to, how quickly can we put a lid on it and prevent secondary and tertiary transmission, spreading to a large number of subsequent groups of people. So the calculations that you're asking about are really to help inform how we will do with monitoring the contact tracing component, who needs to be quarantined, isolated, for how long, what was the exposure risk. We will still be able to do that effectively with our stable groups coming together, even in a competitive situation, but that's where the structure that Director Coit referred to earlier is going to be critical in helping us effectuate that.
Would you consider athletes running by each other, close contacts? I know you talked about close contacts yesterday, but would you have to reach out to the other team if someone on another team tested positive, or would you not consider that a close enough contact?
We take each situation as it is based on the information that we learn. The direct close contact definition really requires less than 6 feet for 15 minutes of time. So a quick run past, especially if someone is wearing a mask, also outdoors, while people are hand sanitizing and we're keeping the equipment clean, has a much lower risk than someone who's in a huddle for a half an hour being coached with no mask for a close period of time.
Doctor, you didn't get a chance to answer the second part of my question about, as my example, that's Exeter West Greenwich, which is you play Central Falls.
Yep, I was about to turn back to you to do that. So a key component in looking at our data is really looking at the numbers. It's what sets Rhode Island apart. When Central Falls had the higher case rates that led to the indication that they would not be opening. When you looked over the course of the week, that was really 22 cases in Central Falls. That may compare to 10 or 15 or 20 cases in another community. We have to be clear in understanding it's not as if there is some stigma assigned to the communities that have a few more cases. It's a situation where we as an entire state want to make sure that each community has as few cases as possible and that we support each other. So I want to really implore, particularly on behalf of our students and the children who are involved, that the adults recognize that we are just talking about a small difference in the number of cases. There is not something that each child is at risk of carrying or causing harm to another child in any way. We want to help our entire state ensure that we have as few cases as possible and put the systems in place to allow our students to get the best education, in-person education as possible, safely, with the teachers that love them, willing and ready to do what's needed, and the best sports activity, safely done, supporting the emotional, physical, and intellectual well-being of our students.
Thank you very much.
And we